Welcome, everybody, to Avoiding the Addiction Affliction, brought to you by Westwards Consulting, the Kenosha County Substance Use Disorder Coalition, and by a grant from the state of Wisconsin's Dose of Reality Real Talks, reminding you that opioids are powerful drugs and that one pill can kill. Mike McGowan. Fetal alcohol spectrum disorder, or FASD, affects up to, are you ready? 1 in 20 people. It is particularly prevalent among young people in the adoption and fostering system. It's a hidden brain injury, and FASD can manifest itself in ways that often lead to really challenging behaviors, which makes diagnosis and intervention also challenging. We're going to talk about FASD today with Mollie O'Brien, the Executive Director of Proof Alliance in St. Paul, Minnesota. Mollie is a nonprofit healthcare leader and integrative health practitioner, and even though it's not relevant to today's conversation, I'm really envious, Mollie, because she's also a former registered professional archaeologist, and you don't know how I want to go off on a tangent there, but I won't. Welcome, Mollie.
Good morning, Mike. Thanks so much for having me here and being a part of this important conversation.
Yeah, I'm so glad you could do it. The stat I cited earlier about 1 in 20 people, that's a whole lot of folks. Yet I'd be willing to bet that a lot of people listening to this, in fact, I would be willing to bet, Mollie, that a lot of people who heard the introduction heard me say fetal alcohol syndrome, not fetal alcohol spectrum disorder. And there is a difference between them, right? And people don't know.
Absolutely. It's really surprising. And in fact, before I took on this role almost 4 years ago, I was not aware of those statistics either. It's just up to 1 in 20. That's in every single classroom across America. It's really startling statistics. And yes, I think it used to be known as fetal alcohol syndrome. We now really recognize it's a spectrum similar to autism. It's a spectrum disorder because it shows up in every kid, every person differently. FASD affects every part of the brain and body. And depending on when that alcohol exposure happened and the extent to which it happened, it's just going to look differently in every kiddo. I think very often folks might be familiar with people who have the facial features associated with FASD or fetal alcohol spectrum disorder, but that is like just a tiny percentage of the kiddos who have FASD. So, yeah.
What are some of the things outside the facial characteristics we might see?
Yeah, so FASD, it's a permanent lifelong disability. There is no cure, and it's a brain-based disability, right? So like a brain injury, but it can affect all parts of development. It's the world's leading cause. Prenatal alcohol exposure is the world's leading cause of developmental disorders. So we really see this impacting so many different pieces of the brain. Executive function is a big place where this shows up. So things like you might see an individual with FASD having difficulty in school, could affect coordination. They might be sensitive to light, touch, or sound. They could have some hyperactive behavior, hard time paying attention, hard time with memory, could affect social skills, impulsivity, reasoning, and judgment. A whole host of different ways that this can show up.
Why do you think it goes so undiagnosed and untreated? Is it because it looks like so many other things?
Gosh, lots of different reasons. Not enough awareness in
Hmm.
community that this exists. I think folks, general sense, I think general understanding that don't drink during pregnancy, it does something. But I don't think we really understand in the general public that it causes fetal alcohol spectrum disorder. It causes a brain-based permanent disability. So really getting that information out there is core to what Proof Alliance is doing and what all kinds of organizations are doing across the country. There's stigma. It's hard to talk about if you're a person who might struggle with, be challenged with chemical health issues, and you may have consumed alcohol during your pregnancy. It's hard to talk about. There are not enough medical providers, so pediatricians trained to recognize this in our kiddos, and there's not enough physicians and healthcare practitioners who are really equipped to have these conversations with pregnant people when they're serving them within those clinical settings to be able to ask about alcohol use and educate about alcohol use during pregnancy. It's a sensitive topic. And then when it comes to getting a diagnosis, if you're a parent or a caregiver who might suspect this in your child, because you're seeing when they're entering that school age and you're seeing some differences, some brain-based differences in these kiddos, you might be going in for a diagnosis, but you're going to sit on a wait list for probably 9 months before being seen. So huge opportunity for educating the public, educating our healthcare providers, educating the school systems. So lots of reasons why.
Okay, I want to ask you about the diagnostic part of this because when I was preparing for this, I looked at the links on your website, which is fabulous, and we'll put links on there for those of you listening. And the University of Minnesota, it's like boom, it's right there, their hospitals. But as I looked at other ones across the country, especially in our state in Wisconsin, I couldn't find it. And even calling for follow-ups, they're like, "What are you talking about?" And these are places like Children's Hospital, right? So not every place does it. So who do you go to for a diagnosis? How do you know that the person you're going to is trained in or recognizes fetal alcohol spectrum disorder?
Yeah. Mike, this isn't a simple blood test. For some health conditions, it's a blood test and it's a quick blood test, or
Mhm.
maybe it's a diagnosis that might take an hour. Diagnosing for fetal alcohol spectrum disorders is a multifaceted process that involves a screening, a medical appointment, a neuropsychological exam, interviews with caregivers and parents, and then pulling all kinds of records to try and confirm that exposure, right, in prenatal exposure. So it's a comprehensive process, takes a really long time, and takes specialized training to do it. So there is kind of limited access right now. Proof Alliance, we have an on-site diagnostic
Yeah, you
clinic where
do.
we provide this service. But even at our clinic, which we set up to try and reduce that wait list, there's still a 9-month wait list. So real demand across the country and real opportunity across the country. Not everyone can get to Proof Alliance, right? If you're living in maybe Texas. So we do have on our website, which is www.proofalliance.org, we do have a list of FASD diagnostic clinics.
Yeah, you do.
Yeah, yep.
It's
That people,
extensive too.
yeah.
Your website has links to all sorts of different stuff.
We do. Yep. It's really a kind of a one-stop shop if you're trying
Hmm.
to just learn about what FASD is, if you want to understand the impact of prenatal alcohol exposure, if you might be interested in what a diagnostic process looks like, if you want to understand, say, the differences between FASD and autism and ADHD, there's so many acronyms.
Hmm.
And if you want to get involved, if you want to start becoming a community educator or an advocate, we just have a ton of resources on our website. And really, our job is to educate the public and partner with you and empower you to help advance this really important cause.
We're talking about diagnosticians, but almost all of these kids are in a school of some sort. I'm in schools all the time, and I do hear things like autism and Asperger's and ADHD. I've been doing this a long time. I don't think I ever hear FASD.
Yeah, so much opportunity for education. In fact, we have an on-site, what we call our e-campus. We provide a ton of education and training as an organization. That's in person. We provide on demand. We have pre-recorded webinars, but we just launched a really important continuing education course for teachers, where teachers, at least in Minnesota, can receive no cost continuing education credits to learn about FASD, right? Because they are experiencing it and encountering it in their classrooms, whether
Hmm.
they're aware or not. And the more we can empower our teachers to know how to navigate the strengths of these children and the challenges and learning differences in these children, the better those classrooms are going to operate. So we really want to be able to empower our teachers in those classrooms to understand what FASD is and how to navigate that effectively.
Yeah, we've also heard from foster parents and adoptive parents that their children may also experience RAD or reactive attachment disorder as well. These things go together sometimes.
Yeah, oftentimes we see, you asked earlier about diagnosis, and oftentimes we see misdiagnosis, underdiagnosis, but that misdiagnosis might happen because initially a parent or a provider who might not be trained in FASD might diagnose them with ADHD or maybe autism. And sometimes these things can fold in and those comorbidities run together. Yep.
Who should do the diagnosis and when? Is the screening only for the mom, or can you also, how early can you screen the newborns?
Yeah, great question. So I want to talk a little bit about our Safest Choice Learning Collaborative. So we have some money, a grant, sorry, through the Health Services Research Administration, HRSA, and we partner with Boston Medical Center to train healthcare clinicians across the country. So there's two cohorts of clinicians who move through this training process. One are clinicians who are serving pregnant people, and two, it's pediatricians who are serving the kiddos, right? Because what we want to do is equip those medical providers to ask pregnant people, right, when they're coming in about alcohol use during pregnancy and be able to intervene right at that moment and be able to have that tricky conversation and address that stigma, right? And then we want to
Hmm.
equip our pediatricians to be having conversations with the family as well, so that diagnosis and that prenatal alcohol exposure can be recognized as early as possible. So screening can happen with the pregnant person, or it can happen with those kiddos as early as possible. That said, what we typically see is caregivers and parents with kids who are entering the school system. It's like preschool, kindergarten, where the parents or caregivers are realizing that their kids are learning differently and facing different learning challenges and behavioral challenges and emotional challenges in relative to their peers. And that's when we see parents and caregivers questioning, is it ADHD, is it autism, is it FASD, and looking around for that diagnosis.
I was grinning during parts of that because I've done this for a very long time working with families, and stigma and asking questions. It's interesting. The people who are doing the screening have to develop some rapport with people so that you get as honest an answer as you possibly can. Because as you said, stigma lends itself to not always telling the full story.
Absolutely.
And what are some ways we can help the child, even if we don't know, who may have FASD? What are some strategies and who would implement them?
Yeah. Proof Alliance, we do a ton of prevention work. We have an on site diagnostic clinic. We do public policy work. But one of the most important things we do is we have programming for kids and families and caregivers who are impacted by FASD. And we don't just allow kids with a formal diagnosis into our programs. We also allow kids who have a suspected FASD to enter our programs, recognizing that diagnosis just might not be clear. There might be missing information. Maybe someone's still on the wait list to be seen. We don't turn those kids and families away. And that programming, one of the most important things is being around people like yourself and recognizing that you are not alone. So being able to
Mhm.
create those social connections, support systems. So we offer social and recreational activities. So think like tube, just like sledding, think of roller skating, think of going to a gym, think of working with horses. We do all kinds of creative activities with kids and families to really create an environment where kids can recognize themselves and those around them. Caregivers can share what's working well and what's challenging with one another and provide that support. We provide leadership development for youth. So there's just so much education, social support, and skill building that we can provide kids and families who are living well with an FASD.
I think living well is an interesting way to put this. Also, I've also talked to a number of adults now that this is becoming a little bit more known, who have gone in for screening. And I've talked to a number of adults who say, hey, I've got this. So it's not just for kids anymore. It's like finding out when you're 30, 40, 50. Oh my gosh, now I have an answer for what I've been dealing with for a long time.
Yeah, absolutely.
How do they interact in the system? How do the adults come? Will you also diagnose and help the adults who think that they may have had it or been exposed? Because they're also then thinking about passing it to their own children.
Yeah, I love that you asked that question. Earlier, we said up to 1 in 20, and that's not just 1 in 20 in the classroom, it's 1 in 20 in the workforce, it's 1 in 20 in your neighborhood, right? And we are seeing, as there is awareness growing and building, that we are getting more inquiries from adults. And so we've just recently launched a young adult program. Before, Proof Alliance really focused on kids, and we're now really beginning to
Right.
recognize there's a need in all generations for this work and this support.
Yeah, that's great. I know this is going to air a little bit later, but you have a conference coming up, and unfortunately, we're going to air this later. But we were talking before. How many people are coming so far?
Yeah, like almost 200. And we had that many last year, not just from Minnesota. Folks are
Yeah.
coming from around the country, and we now have international participants as well. And this conference, it's not too late because you know what happens every year. So get this on your radar
Yes.
for next year. It's a caregiver conference. Parenting kiddos with FASD is different than parenting kiddos without FASD. But what we learn at the conference about parenting kiddos with an FASD, you can apply to any kiddo. My child does not have an FASD, but what I learned at our caregiver conference is applicable to helping me become a better parent too. So I think the content's relevant for everyone, and parenting is hard.
Yeah.
So we need each other to learn what's working well, and let's talk about the science and have the science inform that. So yeah, it's a few days every year, very low cost conference because we just want people to be able to attend.
I would think that also interacting with the adoption and fostering systems is important since it shows up a little bit more frequently in those systems.
Yeah, disproportionately represented in those systems. In fact, I was about a year into my work at Proof Alliance, and I was talking with my aunt, actually, there in Wisconsin, not too far from you, Mike. My aunt and uncle, I just love them, and they fostered, I don't know, probably 50, 100 kids and adopted
Wow.
at least 7 of them.
Wow.
But after I was talking with them about my work and FASD, they shared that one of their children, they understood through that adoption process, was prenatally exposed to alcohol. So my cousin lives with an FASD, and now that I understand FASD more, I see how that kind of shows up for him and for us in our family in that way. So yes, definitely disproportionately represented in the foster and adoptive system. Mm-hmm.
So when parents and guardians and caregivers take their kids to healthcare, pediatricians, whatnot, schools, what questions should they ask so that it brings this on the radar for practitioners?
Can you ask that question in a different way?
Yeah, I'm going to go into a meeting with the school, and I've now learned a little bit about FASD, and I'm not sure the school knows about it. What can I ask the school or my pediatrician that says, are you even looking at this?
Yeah, I think just asking those systems what training they have in place for their professionals so that kids, so that this disability gets recognized and gets addressed within those systems. And kind of making changes at the system level is really imperative. But earlier we were talking about the adoptive and foster systems, and gosh, before I was on board at Proof Alliance, the organization did some really good work at the legislative level to pass legislation that all foster families, when there is an adoption taking place, that those families are provided education about FASD within that process, right? Because we know the prevalence is so high. And so kind of intervening early to make sure that there is awareness about caregiving and parenting those children effectively, that's built in, right? And so that's where policy change can be really critical.
And that's in
So
Minnesota. That's legislative in Minnesota.
it is indeed. Yep.
Wow.
So I'm answering your question in two ways. Those personal conversations,
Yes.
you talking to the teacher, you talking to the doctor, those one-on-one conversations where you're calling the question, so important. And working at the system level to change those systems is also really critical.
Yeah, I think I've done this for a long time, especially the work in schools. And I think you have to be an advocate for your own child, your own, because even though there are experts in all of those places, they're also very busy. And so you have to almost say, slow down, let's take a time out. Are you looking at this? What is this? Could it be this? And if it is this, what are you going to do about it?
Yeah. And that online course I mentioned for our teachers, that's available to anyone across the country. So yeah, when you have those conversations, then refer them to that free online continuing education course for teachers.
That's great. And again, for those of you listening, we'll put a link on the website for that as well. You have so many connections and resources. You got to have a lot of success stories. What makes you happy? What do you see that just makes you just grin?
What I see that keeps me grounded in the work and keeps me excited about the work. So one of my favorite stories, I wanted to visit our family camp. So every year we have what's called a family camp, which is we rent out a whole retreat facility, a whole camp facility, and we have families come up for a few days to spend time together, right? To boat and to do all of the summer things that we do at camp. And a parent came up to me and she said, with tears in her eyes, "This is the first successful family vacation we've ever had." Typically, we go to a resort, we go on quote vacation somewhere, and people are staring at us, thinking something is wrong with our parenting, that we're bad parents because of how our children might be behaving. And so she says to me, and now we're here, and my kids just to get to be themselves around other kids who have a similar disability, and we're not being judged. Instead, we're being fully embraced and understood. And this is just the best vacation we ever had. And knowing that we're creating environments where people can be embraced for being who they are, yeah, that makes my day. That
That is
makes me show up for
awesome.
work.
Yeah, that's a whole nother conversation. There's stigma all over the place, isn't there?
Yes. Yeah. Yep.
I would encourage all of you who are listening and want more information to access the link we put for Proof Alliance on the blurb of this podcast. There's just so much information. It's just outstanding. Mollie, thank you so much for having this conversation today. I appreciate your work, appreciate your dedication, and appreciate the time you took today. For those of you who are listening and watching, we want you to be safe, be well, take care of yourselves, and I guess learn a little bit.